Welcome to From Awareness to Action, linking communities to tobacco quit resources in Kentucky. My name is Gabrielle Cochran, and I'm the program coordinator of Empower, and I'm excited to be here with you today. Thank you for joining us. This is the second webinar in our three-part series. The purpose of this webinar is to share the best practices in tobacco prevention and cessation for those organizations that work with the community. We'll be sharing some of the lessons that we've learned from our work in the community, and we'll also be highlighting available resources in Kentucky. The focus of this webinar is cessation. What are barriers to quitting? What resources are available, and where can we find them? Empower is a CDC-funded initiative that is focused on reducing the use of flavored and menthol tobacco products through tobacco prevention and supporting cessation efforts, primarily in Lexington and Louisville. At Empower, we are a community-centered program that focuses on uplifting community voices to better serve the community. As you may have seen in our last webinar, Kentucky has a unique landscape, being one of the top 5 states in terms of adult smoking rates. Currently, rates of tobacco use of all kinds in Kentucky are higher than the national rates. Due to targeting of the industry and other external factors, Black individuals have rates of menthol cigarette use that are higher than all other race or ethnicity categories. Additionally, youth are impacted by menthol use as well, being the age group that uses these products the most. Now, as we look to cessation support, it is important to note that people want to quit using tobacco products. Studies show that 67.7% of adults who use tobacco products want to quit, and 53% of adults made at least one quit attempt in the past year. Still, of the adults who made a quit attempt, only 38.3% used evidence-based treatments, demonstrating a need to share these evidence-based treatment methods. There are similar rates for youth who use tobacco products. 65.3% of youth who use tobacco products want to quit, and over 60% of youth who use tobacco products have made at least one quit attempt in the past year. If we look to the use of menthol products, 72.2% of people using menthol products want to quit, which is significantly more than those not using menthol products. Still, despite a higher desire to quit and a higher likelihood of making a quit attempt, people using menthol products have lower quit rates. So how can we improve the odds of a successful quit attempt? Well, looking at the social context of tobacco use can be helpful. People who are quitting tobacco products may have people around them that also use tobacco products. So teaching people how to talk to people about not using tobacco products around them, or even joining them in a quit attempt, can be helpful. We also know that social support from friends, family members, and even coworkers can be helpful in improving the chances of a successful quit attempt. This support could be encouragement, or active listening from another person, getting helpful advice or resources, or assistance with personal responsibilities during a quit attempt. Tailoring cessation resources can also improve chances of cessation. Centering community members in the discussion and creation of these materials is essential. Where possible, use tailored materials. Also, identify local barriers to quitting and relevant strategies for reducing the impact of these barriers by talking with the community. In our work, we identified 4 major barriers to quitting. The first was mental health. Many community members at our tabling events from all across the lifespan indicated that stress and anxiety were common reasons for starting and continuing tobacco use. We also heard in these conversations that most people in our community had not heard of the quit line, much less use the services. Third, community surveys found that of people who tried to quit, many experienced withdrawal symptoms from trying to quit cold turkey or without any evidence-based resources. Now, this can also decrease the chances of a successful quit attempt. Lastly, community surveys showed us that there was a lot already going on in the community that impacted community priorities. It may be challenging for people to think about quitting when they're struggling with the lack of housing or using multiple substances. As a reminder, we identified these barriers through our work in Lexington and Louisville. So make sure to determine what barriers exist in your community. The two most common withdrawal symptoms we've heard are stress or irritability and cravings. Good coping skills recommended for dealing with stress or irritability are breathing exercises, finding a support person, or taking the time to reward the successes. For cravings, coping skills include finding a healthy snack, chewing gum, or using flavored toothpicks. Another commonly recommended strategy for coping is using the 5 Ds. The first of these is to delay. Cravings typically only last a few minutes, so by putting off tobacco use, you can actually go longer without using tobacco or not use tobacco at all. The second is distracting. So do something to take your mind off of those cravings or the withdrawal symptoms. The third is to drink water, get a healthy snack. Fourth is deep breaths, so using those breathing exercises that we mentioned earlier. And lastly is discuss. Encourage people who are quitting to find someone who they can lean on for support, who they can talk to about their successes, challenges, and just generally have a conversation about what's going on during this quit journey. Next, we'll look at a lot of the resources that are available for community members trying to quit using tobacco products. Even if you don't use all of these, it'll be helpful to know what exists. The first thing we'll look at is the two main quit lines here in Kentucky. The first is the Kentucky Quit Line, which is intended for adults, those 18 and over. Currently, what's included in the Kentucky Quit Line is one free coaching call for everyone. The Quit Line helps to prepare individuals for triggers and setbacks that come with quitting and can even provide nicotine replacement therapy for select individuals. My Life, My Quit is a texting based service intended for youth, so those 17 and under, and they offer coaches that are trained to help adolescents manage those quitting symptoms. The QR codes are provided on the screen if you'd like to investigate these services further. Nicotine replacement therapies, or NRTs, and medications are another category of support for people quitting. NRTs, like the patch, gum, and lozenges, are available over the counter. Still, please use caution before recommending or providing these to people, as there are various factors that influence the use of these products, and there are procedures that must be followed for people to use them properly. We don't want to cause additional health concerns for someone trying to quit, or let improper use discourage people from quitting with a nicotine replacement therapy, since they are evidence-based and can improve the likelihood of a successful quit attempt. NRTs are included in this webinar for reference, but if you're interested in providing or recommending over-the-counter nicotine replacement therapies to people, additional training opportunities or collaborations are needed. Additionally, the inhaler, nasal spray, and two different medications are available by prescription. Since they require prescription, you may not be able to provide these to people, but you can connect people to those who can give out these prescriptions. There are also a number of resources available for most people online. One includes the Kentucky Cancer Program, which offers a free session that connects individuals to quit resources. The American Lung Association offers freedom from smoking classes online as well, though these run about $100 a person. Additionally, the National Cancer Society offers two free services, the Quit Start app and texting programs, both of which are available at smokefree.gov. Truth Initiative offers the X program and Outsmart Nicotine, which provide free services to youth and young adults. Lastly, finding tobacco treatment specialists or those with TTS training can be a good resource for individual or group cessation support. The cost for these services does vary, but most of these TTS individuals can be found adjacent to healthcare facilities. Locally, there are also a number of different resources that you can find. Local health departments may offer cessation support for low costs or even free. Local or regional hospitals may also offer low or free cost programming. Depending on the individual, they may have an insurance provider that offers quitting services to those on their plans. Insurance providers can also help cover the cost of tobacco cessation medications, counseling, and nicotine replacement therapies. For anyone in a form of higher education, such as college, they often offer free programming for students and staff. Reflecting on this and why it matters is that people want to quit. As we saw, over 60% of both youth and adults want to quit. Many just don't know the resources that are available to them, or they face barriers that make it harder to access these services. Through our work, we can address barriers to cessation by sharing these resources that do work and helping community members identify what resources are available to them. Remember that you don't have to be a certified tobacco treatment specialist to make a difference. All you have to be is a community member who cares and shows up for the community. Be sure to join us for the next session in the series. Session 3 will focus on working with youth and countering the flavor trap. If you haven't already, check out Session 1, which covered the tobacco landscape in Kentucky and lessons learned from our community. Each of these sessions is designed to build your skills and to expand your toolbox for countering tobacco use. Lastly, we'll want to thank you all for watching this video today. Please visit the Prevent website to access resources or follow us on social media to stay connected. If you'd like printed materials, Prevent speakers, or quick kits for your community, don't hesitate to reach out. All of our information is provided on this slide. Remember that together we can build a healthier Kentucky, one conversation, one connection at a time. Thank you, and we'll see you in the next session.